If you have any questions at all, I just mentioned the website. If you're new to the show, you might not know this. You can always send me questions through my website, drjoe.com, drjoe.com. Health questions, I'm happy to answer them. Had a patient this week. She came in. She was a nurse. And she had several different things. Back pain, neck pain, digestive issues. And so I sat down, I discussed things with her. And at a moment, she goes, I want to stop you for a second. I said, why? What's wrong? She goes, I've been in the health field for 35 years. She goes, I've never, ever, in all the doctors I've confronted in 35 years, ever had anybody sit down and talk to me and answer my questions the way you do. She goes, and I just want to thank you for that. I've never had that happen. And as a nurse, she had access to everybody. So we all have health issues. And we don't know where to look. I have health issues. I have to turn to some experts. Usually I have to look things up myself. But this is the new trend in healthcare. I was at a meeting last week with a bunch of doctors, and it's a company that does full body scans from literally from top of your head to the bottom of your toes. And it's an MRI, and it tests everything. It checks over, 13 million different points or something like that. Checks for 5,000 different things. And it was interesting because I was the only non-medical doctor in the room. And they all said the same thing. They all said, I'm just sick and tired of the way healthcare is going. I'm burned out. I'm not getting the results that I want. I'm so locked into what I have to do. I want to go into this what's called functional medicine. That's what we're talking about today, what I've been talking about for 40 years. It didn't have a name back then. And two of the guys in the room recognized me, and they said, you're Dr. Joe. I said, yeah. And they said, I want to be you when I grow up. I want to do what you do because it's phenomenal. The way you break things down and explain it. They said, we never learned any of that. And so the healthcare world is shifting. A, doctors are wanting to get out because they're getting burned out. And B, people are having more awareness about their own health. So that's why I want to be your doctor. I want to help get to the cause of your problems and not just treat the symptoms. So let's jump right in. We covered a bunch of warning signs last week. I'm going to cover more this week. I want to talk about digestion because there's some digestive signs that are minor, some that are something you want to get fixed right away, and some that are, I need to get to the emergency room immediately. Now, I've been in practice 40 years. The number one reason that we see patients in our practices is pain. Neck pain, back pain, shoulder pain, numbness, tingling, sciatica, headaches. We're really good at getting to the cause of your healthcare problems and not just covering up the symptoms. I am perfectly fine covering up the symptoms. I got a headache. I want that headache gone. But I want to find out why I have the headache. And that's a different approach. Usually it's just cover up the pain and leave it from there. Number two reason we see patients with digestive problems. And I always joke that everybody's got them and nobody talks about them. Not dinner conversation, right? So let's talk about some issues that are very serious. If I get a stabbing pain on my lower right side, right above my hip on my right side, and it's like a knife going into my body, you want to get to an emergency room right away because your appendix might be bursting. Now, a test you can do, it's called a rebound test. You can push in where the pain is and then flip your fingers really fast. And if it hurts really bad, you want to get to the emergency room right away. Because if your appendix ruptures, your appendix is part of your large intestine, between your small and large intestine. And if the contents of your intestine leaks into your body, that could become a very serious issue. So if you have a ruptured appendix, you want to get that treated right away. If you start getting a fever, you want to get that treated right away. So it becomes a really serious thing. Don't ignore that. Now, if you just have a bellyache, probably not that big a deal. But if you have that sharp stabbing pain, it's something you want to take care of right away. If you have bloody stools, there's two things that can happen if your stools are bloody. Number one is it could be that you have a hemorrhoid and it's just leaking blood. And that's it. It could be that you rigorously tried to clean yourself. And that could be an issue. So red blood, maybe not so serious. But you should get it checked anyway. If you have dark blood, like it looks like coffee grounds or like scabs, that means you have bleeding in the upper part of your digestive system, maybe your stomach, your upper part of your small intestine. You want to get that checked right away. It doesn't have to be rushed to the emergency room right away, but you want to get it checked in the next couple of days. Those are things you don't want to ignore because bleeding internally can be a very serious issue. And sometimes I have patients come in and they'll say, hey, Dr. Joe, I have low iron. Okay? And they say, doctor, put me on iron supplements. It's not changing. That's something that you may have internal bleeding with. Your intestines may be bleeding internally and you're losing blood into your digestive system. So that's something you want to get checked as well. Now, if you have anemia, it could be several different things. It could be you're low in B vitamin, B12 specifically. Now, this happens a lot, that patients come in and say, Dr. Joe, I'm low in B12. So the doctor gave me some shots of B12. Okay, makes sense. I'm good with that. But if you're eating a good diet, if you're taking B vitamin supplements, specifically methylcobalamin, that's the type of B12 that's easy to absorb, and you're still low in B12, it may be a digestive system issue. Because in your stomach, you have something called intrinsic factor. Intrinsic factor allows you to absorb vitamin B12. Well, as you get older, your intrinsic factor levels drop, but also you need stomach acid to activate the intrinsic factor to absorb the vitamin B12. Did you follow all that? Many people are on medications to lower their stomach acid. How many of you are on medications? Raise your hands. A bunch of you are. You're on medication to lower your stomach acid, which means you're not activating the B12, the intrinsic factor, even if you have it. So you may not be absorbing B12, which can lead to an anemia type problem. So who would have thought that taking those innocent little pills over the counter, because I have acid reflux, can lead to B12 deficiency? Well, now you know. So I'm not against trying to fix the symptom if you have acid reflux and taking a medication. But understand that medication was probably only intended to be used for a maximum of 6 weeks. And here's something I bet you never knew. You may have never did. If you're taking a medication for acid reflux or heartburn, read the directions. Most of the directions are pretty clear. It says take for 6 weeks max, or maybe 8 weeks, 4 weeks. It says there's a finite amount of time you should take it and then stop. A, how many of you have ever read the directions? And B, how many of you have never stopped? Most of you never stopped. I have patients taking antacid medications for years, 10 years, 20 years. You're lowering your stomach acid, several things happen. Number one, don't activate intrinsic factor. So you need intrinsic factor to absorb B12. Number two, you need stomach acid to keep the food in your stomach. What does that mean? When you swallow food, you have something called your esophagus. And the food goes down your esophagus, and there's a hole in your diaphragm. It's called the sphincter, lower esophageal sphincter. And the valve opens and lets food drop into your stomach. Then that valve, the lower esophageal sphincter, closes. And then you digest your food, you pass it on to your small intestine, and on with your absorption. Well, you need stomach acid to cause that valve to close. Acid sends a message to the valve and say, hey, close. I eat food, my stomach produces acid, the acid tells my valve to close, I close my valve, I digest my food, and I pass it on. If I start lowering my stomach acid, what happens? I don't have enough acid to close the valve stays open, food refluxes up into my throat, and I get acid reflux. So what do? I take medication to lower my stomach acid, which then prevents the valve from properly closing. So you see this little cycle here? Not good. And you need stomach acid to absorb calcium, B12, iron, and magnesium. So if you're lowering your stomach acid, you run the risk of becoming deficient in calcium, B12, iron, and or magnesium. So now we got a problem. Problem is I've got acid reflux. I need the medication to stop my acid reflux, but if I lower my stomach acid, I can't absorb calcium, B12, iron, magnesium, and the valve doesn't close. Oh, and by the way, you need stomach acid to digest protein. Now, if I eat protein, it cooked from a carrot, from a steak, almost everything has protein, I think, except water. Protein looks like a ball of yarn under a microscope. So the acid in my stomach unravels that ball of yarn and chops it up into something called amino acids. Now, there's 20 amino acids in the human diet. And basically, you break them down, it goes to the liver reassembles them and creates liver and eye tissue and hair and toenails and blood. So that's how that game is played. You have to break down the proteins into amino acids using stomach acid, and then the amino acids become every part of your body. If I lower my stomach acid because I'm taking medication, I'm not able to properly digest my proteins. So I'm not able to properly get the amino acids to rebuild my body. Now, we think about amino acids in muscle, right? Oh, muscles are made of protein. But there's something in your brain and in your body called neurotransmitters. Neurotransmitters make your brain work. There's 4 big ones. So I break down protein into amino acid. The amino acid tryptophan goes into my small intestine, combines with vitamin B6, and creates a chemical called 5-HTP. Tryptophan, B6, 5-HTP. 5-HTP becomes serotonin in my gut. A little bit is made in my brain, maybe 5%. Most of it is made in my gut. Serotonin then travels up to my brain via the vagus nerve, or it goes to the blood system, and it goes into the brain, and serotonin helps us focus, makes us happy, called the happy neurotransmitter. So many times when people aren't happy, they're depressed, they have ADD, ADHD, they can't focus, they have anxiety, it's because they're not breaking the proteins into amino acids to produce the neurotransmitter serotonin. I've been in practice 40 years. I've seen thousands, maybe tens of thousands of patients. I don't even know. I've never in my career had a patient who had an emotional disorder, anxiety, depression, ADD, whatever it is. I've never had anybody have that issue that didn't have a digestive problem. And every case, and I mean, there may be a time where it doesn't happen, but in every case, in my experience, when we fix the digestive system, the brain starts to work better. That's a heavy-duty statement right there. Your brain works better if your gut's working, because you're able to break proteins into amino acids to produce neurotransmitters. Tyrosine becomes dopamine. Dopamine is a neurotransmitter that gives you pleasure. Dopamine converts into norepinephrine, which gives you energy. Oh, tyrosine, by the way, becomes serotonin. Serotonin becomes melatonin, which helps you sleep. So I know I'm throwing a lot of advanced neurology, biochemistry out at you, but the bottom line is if you can't break your proteins down into amino acids to become neurotransmitters, the brain can't work. Ever. I've had countless doctors, therapists, psychiatrists, psychologists come to me and say, Dr. Joe, I've never heard that before, ever. And it makes perfect sense. Now, it's not going to be end-all, be-all, not going to solve all psychological problems, of course. There's other issues. There's family issues. There's emotions. There's nutrition. But you got to fix the gut as part of the protocol to get the brain to work. So we're talking today about warning signs. I'm Dr. Joe Esposito, if you're just tuning in. We're talking about warning signs you shouldn't ignore. So you have a little acid reflux. You take a little pill, the acid reflux goes away, and you ignore it. You go on decades sometimes. But I just explained to you why that's such a serious issue and why you should never ignore that. And the good news is this. If you have acid reflux, most commonly the stomach is pushed up into the diaphragm. And in many cases, I would say most cases, we can physically adjust or pull the stomach down away from the diaphragm. And we pull the stomach down away from the diaphragm, that valve is able to close. We get you on simple things like apple cider vinegar. Apple cider vinegar increases your stomach acid, which can cause that valve to close. And now what do we just do? We treated the cause of the acid reflux, not just treat the symptoms. I'm not saying it's going to cure every case of acid reflux. I am saying that I've seen amazing results in 40 years when we do that. So many of the things I teach you can do yourself. You can take supplements, you can take apple cider vinegar, but if the stomach is up against the diaphragm, you need to come see us because we can actually physically pull it down in most cases. Now, if you do have a health issue, not just stomach issues, neck pain, back pain, shoulder pain, headaches, sciatica, my team of doctors are really good at getting to the cause of the problem. So if you want to make an appointment to come see us in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge, or we can do telehealth if we need to, I would love the opportunity to be your doctor. Let's check your nervous system. Let's check your digestive system. Let's look at your diet and find out what we need to do to get to the cause of the problem. So if you want to make an appointment, normally the first visit is $940. I've reduced that for you, my listeners, to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Any one of those things individually is going to cost you more than $299. And I'm doing this because I want to find out if you are a candidate for our care. And if you're not a candidate, where I could direct you to go to get the care that I think you need. That's the biggest problem. Well, I want to go to a doctor who's in my network. Are they in my insurance network? Are they good? I don't know. They're in my insurance network. That doesn't mean they're good. That just means they filled out paperwork like we do. So let's get to the cause of your problem. So go to my website, drjoe.com, book an appointment right now. And we accept most insurances, almost every insurance. So drjoe.com. If you have any questions, send them to me through my website, drjoe.com. Happy to answer your questions for you, drjoe.com. I answer questions literally all day, every day. And I'm happy to do that as a service to you. I really want to help you get to the cause of your problems. Make sure you follow us on social media. We post twice a day. You're going to get 2 posts from us a day on healthcare tips, about 1 minute each, absolutely free. So it's Dr. Joe Esposito, Facebook, Instagram, YouTube, TikTok, LinkedIn. Facebook is the Dr. Joe Esposito. But let's get to the cause of your problems. Let's stop just treating the symptoms. I'm okay treating symptoms. Let's get to the cause. drjoe.com is the website. Book appointments, send me questions. We have supplements on the website, and we'll talk about digestion. I'll finish up here. Actually, I got a lot more to do. I take a digestive enzyme every meal, and you should too if you're over probably 40, and I'm over 40, because our digestive enzyme levels start to drop. So even if I don't have acid reflux and my stomach is where it's supposed to be, I'm just not producing enzymes like I used to. So on the website, drjoe.com, in the store section, we have something called Dr. Joe's Digestive Enzymes. I take it every meal. You should too. Now, I lied. I just lied to you. If I eat a salad, something raw, totally raw, I probably don't take enzymes. But if I eat something cooked, I'm always going to take an enzyme. And let me tell you, a couple of days on enzymes, and most people say, man, I'm amazing. I'm digesting food better. I'm going to the bathroom better. I'm sleeping better. You're breaking down proteins into amino acids to help reduce neurotransmitters. Serotonin becomes melatonin. Melatonin helps you sleep better. Your body heals. There's no downside to trying to get your body healthy. And so all our supplements, the minimum supplements I think everybody should take are Dr. Joe's Super Greens and Dr. Joe's Essential Source. There are 2 powders. I take a scoop of each. We have different flavors. You could try different flavors, see which one you like better. Scoop of each. I add 10 drops of Dr. Joe's vitamin D3 with K2. I add creatine to it, a scoop or 2 of creatine. Shake it up and drink it every day. When I say a scoop of creatine, it's tiny, tiny. It's about the size of a dime. And I take that first thing in the morning, every morning. You should too. If you want to shake it up, add some frozen bananas, some frozen berries. You should start every day like that. I do, and you should too. And then I take other supplements. I take nitric oxide support to open up my blood vessels. Before I do a show, before I do a podcast, before I do a lecture, I take Dr. Joe's nitric oxide support to open up my blood vessels and increase circulation to my brain, my heart, my reproductive organs. Everything gets this rush of energy and blood. Don't take it if you have low blood pressure. If you have low blood pressure, send me an email through the website. I'll tell you what to do. But it's amazing. I take men's hormone support because as I'm getting older, I got to build up my hormones. And there's herbs that can actually help my body produce testosterone and other hormones. Omega-3 fatty acids, essential for brain function. I was at a party the other day, and a fellow was talking to me, and this happens a lot. And he's talking to me about, it's Dr. Joe, I listen to your show. I think it's great. I love you. You're wonderful. You're brilliant. Okay, great. What would you recommend for me? And he had erectile dysfunction. He had prostate issues. He had digestive issues. So I laid out about 5 or 6 different supplements for him. And he said to me, it's kind of funny. He goes, well, that's too many. I said, based on what? He goes, I don't want to take that many supplements. I said, so what do you want to do? He goes, well, I want to get fixed. I went around in a circle. I gave up. So it's still cheaper than getting a fancy coffee every day at a fancy coffee shop. Way cheaper. And it's benefits as opposed to negative. So if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about signs and symptoms you should never ignore. If you start to turn yellow, I know that sounds strange, especially around your eyes, you want to get to a medical doctor immediately and get an evaluation. I had a friend of mine, Larry, and very good friend of mine. I knew him for many, many, many years. We were best buddies. Comes in my office one day, and he's starting to look yellow. And I said, you need to go get that checked. He says, no, just give me an adjustment. You can fix everything. You're Dr. Joe. And I said, no, Larry, you need to go get that checked. And he put it off and put it off and put it off. And finally he went, and he had pancreatic cancer. Now, I'm not saying had we caught it earlier, he would have lived. But if you start turning yellow, that's a sign. It could be jaundice. It could be a liver issue. But in his case, it was pancreatic cancer. So I'm not trying to scare you. I'm trying to make you proactive. There's a lot of things you can do for blood pressure, diabetes, obesity, smoking, digestive issues, pain, that you can be proactive about. But unfortunately, Larry was tougher than that, and now he's not with us anymore. So don't be silly. Don't be Larry, okay? Go out and get checked. If you have a problem, you come see me. Like I said, if I can help you, I'll say, listen, I think I can help you. If I can't, I'll tell you that too. Listen, this is out of my wheelhouse, man. You need to go see an orthopedist, neurologist, neurosurgeon, psychiatrist, psychologist, endocrinologist. I don't know. But let's be the starting point. And the reason I say that, and a lot of insurance companies actually come to me with these questions, does this person really need surgery? Or is there an alternative? Because surgery is expensive, and if it doesn't work, it's a problem. If taking supplements doesn't work, which it almost always does, you took some supplements. If chiropractic care doesn't work, very low risk. Could it? Yes, it could have an effect, but very low risk, extremely high reward, very low cost. Let's start with the most effective, least expensive protocol overall, and then let's build up from there. I don't know, maybe I'm logical, but I'm a linear thinker. Let's do the most logical thing first. So if you want to make an appointment, drjoe.com. If you have any questions, drjoe.com. Happy to work with you to see if we can get to the cause of your problem. And we accept most insurances. I mean, people get freaked out over insurance. Had a guy call me the other day, and he was a veteran, and he kept saying, I want to come see you, but I got to get and I'm on the VA referral list, by the way. So if the VA refers you to us, they pay for everything. And I said, let's assume the VA doesn't pay. What are you going to do about your problem? I don't know. Don't you think you should get it fixed? You're just going to let yourself deteriorate, maybe pass because you didn't get the problem fixed? I never thought of it like that before. I always think if it's not covered by my insurance, I can't go see a doctor. No, you can see whoever you want to. It's up to you, okay? I'm going to tell you about another symptom a friend of mine had. I've known this guy for, 25, 30 years now, and very good friends. And he was saying that his hands was swelling, his feet was swelling. And he said, no big deal. It went away, came back, went away, came back. So we're out to dinner one night, and he calls me after dinner, and he says, my tongue is starting to swell. Okay, that's a medical emergency. Get yourself to the emergency room. He went to the emergency room. They pumped him full of anti-inflammatories. He says, I need to get checked. I said, why don't you go see an allergist and get tested? And he got tested, and he came back positive for something called alpha-gal. Anybody ever hear of alpha-gal? Alpha-gal is a condition that comes when you get bit by what's called a Lone Star tick. And when you get bit by a Lone Star tick, your body isn't able to process, I think it's galactose 1,2-alpha-galactose. It's a sugar that's found in mammal meat. So pigs and cows, humans, I guess, too. And when you eat it, your body has a severe allergic reaction to it. He got tested. Doctor was smart enough to test for alpha-gal. He has it. He's an outdoorsman. He mountain bikes and hikes and everything like that. He got bit by a Lone Star tick at some point in his life. He can never eat mammal meat again or dairy products because he has a condition called alpha-gal. Now, I'm not too upset over that because I don't think people should eat meat anyway, but it was quite an eye-opening experience for him. So when his tongue started to swell, that was a medical emergency. Folks, I got to go to break. Don't go anywhere. We've got a lot more to cover. If you have any questions, drjoe.com, drjoe.com. Happy to answer your questions for you. Make an appointment to come see us. The best thing to do, let my team and I do an evaluation. Let's check your nervous system, digestive system, and diet, and let's try to get to the cause of your problem and not just keep treating the symptoms. That's what people like when I say that. And if you have any questions, drjoe.com. Follow me on social media, Facebook, Instagram, YouTube, TikTok, LinkedIn. We post twice a day. And if you send me a question, we even put you on a newsletter list. We send out a newsletter every day. So many ways to get information. And you're not going to get it all. I mean, you go to school, doctors go to school for 15 years sometimes. So there's a lot to cover, but I want to be your doctor, drjoe.com. Folks, I'm Dr. Joe Esposito. Don't go anywhere. We'll be right back. All right. You got questions?
Are yams healthy?
Are yams healthy? The answer is a resounding yes, absolutely. Now, you don't want to coat them in brown sugar and marshmallows, but you can bake them. You can steam them. They're excellent. Way better than white potatoes, actually. And if you're going to cook them, let me tell you a little secret. This is a little Dr. Joe secret. Make your potatoes, or any type of carbohydrates, even pastas, cook it, cool it overnight in the refrigerator, eat it the next day. You create something called a resistant starch. You're going to absorb about 40% or more less carbohydrates than if you just cooked it and ate it right away. And what you don't absorb becomes what's called a prebiotic, which actually feeds the good bacteria in your colon. So you can take something like a yam or a potato, rice. If you're going to do rice, organic California rice is the best. White rice actually is better because it doesn't have as much arsenic. And cool it overnight. You'll be amazed how much better you feel, and it becomes a health food as opposed to something not so good for you. What else you got, John?
What is tofu?
Tofu is soy milk. We take soy milk, and the way we don't milk soybeans. No, they don't have little udders. You boil down the soybeans and you squeeze them, basically. And what comes out is this juice, and that's called soy milk. And then they add a coagulant to it to make it firm up. And that's what tofu is. It's basically soy milk in a firm form. I use it a lot. I don't love tofu. It's not like, oh, I love tofu. Like I say, oh, I don't know, people say I love steak or something like that. But so versatile. I have it in my refrigerator right now, and sometimes for a quick meal, I'll just take it, I'll smash it up. I'll add a little bit of extra virgin organic olive oil, salt, pepper. I might add nutritional yeast to it, and I'll just warm it up in a frying pan. It's like scrambled eggs. Now, it doesn't taste exactly like scrambled eggs, but it has that consistency and look to it. So tofu's great. Make sure you get organic, because soybeans sometimes are genetically modified, so make sure you do organic. So I love it. And if the difference in firm is how much water there is. So soft is just more water in it. Firm is less water. Extra firm is less water. So that's the only difference, is the amount of water in it. What else you got?
Are chili beans healthy?
Yes, absolutely. Vasodilators. Open up the blood vessels. We're considering doing a show called Dr. Joe Uncensored, because I have to follow certain rules, of course, when I'm on radio and on television and stuff. But there are certain things that I would love to talk about, like romantic issues, that I really may be frowned upon by the studios. So I may start a show called Dr. Joe Uncensored, where I can talk about things like that. But vasodilators open up the blood vessels to your romantic parts, your brain. Helps with digestion. So, yeah, chili peppers are great. Just don't burn yourself. Be careful. If it's too hot for you, don't eat it. It's very simple. Everybody's a different tolerance. What else you got?
If you were fixing Thanksgiving dinner for friends and family, what would you cook?
Of course, I don't eat meat. Now, if somebody does eat meat, I don't care. It's your call, okay? It's your choice. Whatever you decide to do is up to you. I choose not to eat meat knowing what I know. And I tell my patients this. If you knew what I knew, you would do what I do. I don't have a choice based on the knowledge that I have. And that's it. It's just that simple. Based on what I know, I could never go ahead and start eating animal products again, but that's okay. If you want to do it, that's fine. I go to a lot of parties. I go to sometimes, especially a holiday party week, 3-4 times a week, I'm at a party. I was at a black tie party last week, and it was black tie. It was at the Porsche Center in Atlanta, so, you know, Porsche is obviously very fancy. And they had a buffet, and they had open bar. And I ate before I went, and they did have some whipped sweet potatoes that were vegan, and I had those, and I think a little salad too. But I don't go for the food. I go for the socializing, the camaraderie. So to answer your questions, do the side dishes. Do the green beans. Do the sweet potatoes. Do the mashed potatoes. If you're going to do stuffing, I recommend a gluten-free stuffing. Of course, I love stuffing. Absolutely one of my favorite foods in the world. A mushroom gravy with just mushrooms. And you can do a flour to thicken it. And vegetable broth. You don't have to put giblets or anything in there. So Thanksgiving dinner is one of the easiest things to do healthy because there's so many side dishes. Just don't do the meat and the dairy products, and you're fine. So that's what I would do. Your typical Thanksgiving dinner, I just, plant-based it. Very simple and good. I'm not sure what I'm going to do for Thanksgiving this year. I've got a couple of choices. I'm not sure what I'm going to do. What else you got, John?
Are any yogurts okay?
If you do a plant-based yogurt, it's fine. In fact, I was at Sprouts the other day. I love my Sprouts. I have no affiliation with them. And they will put things on sale as it starts to come toward the end, before it goes bad. Kroger does the same thing. They have discount racks, basically. And at Sprouts, it was a Ziggy's, Siggis, I think it was. And they had a coconut yogurt, vanilla coconut yogurt, really good. And normally it's $8 for a container. And they put it on for 99 cents. Why? Because otherwise they have to throw it away. So if you're going to do a yogurt, I recommend a plant-based yogurt. Now, a lot of you are thinking yogurt high in probiotics, they're good for me. Not necessarily. Because most of the yogurt is going to be pasteurized before it gets to your refrigerator. And when you pasteurize, you kill off a lot of the good bacteria. So no need. Yogurt, it can be very fattening too. So if you're going to do yogurt, I recommend a plant-based yogurt. But don't look at it as a health food. Look at it as it's substituting for dairy yogurt, and it's fun, but it's not really a health food, no. So, what else you got?
That is all.
All right, let's do part 2. Get my tea. Fenugreek tea today. Fenugreek helps with your hormones. You can buy tea bags. I'll give you a little fun tip too here. because you guys are special. This doesn't go out on radio or anything like that. This is just the fun part. Tea bags oftentimes have microplastics in them. And microplastics, when they get into the body, can cause some real serious damage. I did a whole show on microplastics a couple weeks ago. So I buy loose tea. That's Sprouts because they have a bulk section. I think Whole Foods has a bulk section too. Way cheaper than putting it in bags. And then I got little tea balls, metal tea balls. And I think they were 3 for $12 on Amazon. And I put the loose tea in the tea ball, and it's stainless steel, put it in my hot water. That's how I make my tea. Way cheaper, way better for you. And then you can mix it up. Like I said, fenugreek, good for my hormones. I like anise as well. Anise has a licorice flavor to it. I like that. Comfrey, very calming to the body. Lavender, very calming. Peppermint or spearmint, very good for digestion. So there's medicinal benefits to the tea, but I drink it because I like it. So, all right, ready? Hey, folks, Dr. Joe Esposito here. If you're just joining us, welcome. If you stayed with us, I do appreciate that. Thank you very much. What we're talking today are warning signs you should never ignore. Because we talked about this last week. I have a lot of patients that are taint-nothing patients. What's a taint-nothing patient? They come in and they say, well, Dr. Joe, I have, when I cough, I spit up blood. But that taint nothing. Don't worry about it. My mama had that. Okay, I'm in the South now. My mama had that. Well, mama probably had lung cancer then. So don't be a taint nothing. Taint nothing, ain't nothing. Yeah, I'm playing a little play on words there. Ain't nothing. Don't be an ain't nothing patient. If you have certain signs and symptoms, come see us and we can help direct you as to where to go and what to do about it. Many times, it's nothing to worry about. But I'd rather err on the side of caution. You can always make more money if you're worried about finances. You can make more money, but you can't get a new lung or a new kidney. You can, I guess, but it's pretty expensive. So let's talk about getting you well, so hopefully you never get to those points. Talk about digestive systems in the first part. If you have blood in your urine, that's not good. It ain't a taint, nothing to worry about, okay? It can come from the kidneys, the bladder, it could be prostate issues. Now, it could be from rigorous romance, if you just had a rigorous romance issue, but it also could, if you had a rigorous romance situation, you could also be infected too. So be careful with that. Blood in the urine, go get to your urologist and get that thing checked. If you have painful urination, could be a socially transmitted disease, STD or STI, I think they're called now. Or it could actually be a kidney infection or a bladder infection. Now, women come to me. Women seem to get bladder infections more than men. And the reason is the urethra is much shorter in women than it is in men. The urethra from the bladder to the outside of the body is a very, very short distance. So bacteria have a tendency to get into the bladder more so for women than for men. It's a longer trip. And so if you have a UTI, urinary tract infection, you want to find out why. It could be, there's something called honeymoon cystitis. Yes, that's a real thing. Where you have overaggressive activity in a certain area of the body. And that can cause an irritation and cause an inflammatory reaction. But if you have blood in the urine, you want to get it checked. If you have a UTI, you can try something called cranberry juice. Now, do not confuse cranberry juice with cranberry juice cocktail. A very big difference. Pure cranberry juice, organic pure cranberry juice, is thick and it's very bitter. If you try drinking it, it's very tart, I guess I should say. Not even bitter, it's tart. Cranberry juice cocktail, they dump a ton of high fructose corn syrup in there to sweeten it, to make it palatable. So if you're going to have a cranberry and vodka, well, I'm drinking cranberry juice, it's good for me. No, that's pretty much pure sugar with a little touch of cranberry in it. So pure cranberry juice, you can get it usually in health food stores or most grocery stores, I guess. Organic pure cranberry juice, 100% organic pure cranberry juice. Very tart. You can cut it with water, and you can sweeten it with things like stevia, allulose, xylitol to make it more palatable. But cranberry juice, pure cranberry juice, has a component in it that prevents the bacteria from sticking to your bladder. And that's how it works. It's really not antibacterial. It just prevents bacteria from setting up shop. So you can try that as well. Now, many times when you have problems in the lower part of the body, the colon, the sex organs, the bladder, the one thing nobody ever talks about is the nerve supply to that area. So the nerves come out of my brain, go down my spine, and go out to every part of my body. The heart, lungs, liver, spleen, colon, gallbladder, everything has to be connected to the brain or else I'm going to die probably. If you have damage to the low back, a bulging disc, a pinched nerve, what we call Facet syndrome, if you're pinching the nerve in the low back, that nerve controls the colon, sex organs, and bladder. So I can give you the best chiropractic care, the best surgical care, the best gynecological care, whatever it is. But if I'm still pinching the nerve to the organ, I'm probably not going to get the results that I'm looking for. Or the best results I can get, I should say. So that's where we co-manage the cases with other doctors. Let's check the nerve supply to the organ that you're having worked on. Last week, I had a patient come in, very big man. Came to me, he was 18 years old. That was probably 30 years ago. And he said, he's very large. And he says, I just went to the doctor. I have an MRI, brings the MRI. I'm reading the MRI. He's got 3 bulging discs in his neck and 3 bulging discs in his low back. He says, can you help me? I said, I don't know. It's worth a shot. Because once you have surgery, you're cut. And I'm not against surgery. But if they mess up, it's pretty serious. If getting chiropractic care, if changing your diet, if doing supplements don't work, very low risk. There's some risk, but very low risk, very high reward. So I said, here's my plan. Let's treat you for 2 months. Let's do everything we can to try to get everything back in place the best we can. But you're going to have to listen to me when it comes to diet. He goes, you told me, 30 years ago to give up meat. I ain't giving up meat. I said, okay, that's fine. But at least do organic meat. Let's take digestive enzymes when you eat the meat. Okay, well, I ain't giving up coffee. Okay, let's do organic coffee. Get some of the pesticides and the herbicides out of there. Okay, he finally acquiesced, and we started treating him. So hopefully we're going to get some good results with that. But the nerves in the low back, I said, control your colon, sex organs, and bladder. He goes, oh, yeah, I've been having a lot of problems in that area. I said, did the doctor ever tell you that bulging disc can affect the colon, sex organs, and bladder? No. Okay. So give me 60 days. Let's see what we can do. I tell all my patients that. Give me 60 days, and let's see what we can do. In most cases, the results are phenomenal. And most of my patients, major majority of them say, why didn't I do this sooner? Why did I wait so long to listen to you? Because I've been in practice 40 years. I've been on radio 17, 18, 19 years, I think now. And people say, I've been listening to your shows. I've been listening to your podcasts since they came out. I've been reading your articles. I read your books. And you're right. Well, then what are you waiting for? Come get it done. In fact, my producer, John, right before I went on the air, said, don't forget to mention the first book you ever wrote. It's called Eating Right for the Health of It. And this book has a lot of recipes in it. And the reason I even wrote this book is because people kept saying, well, what do you eat? What do you eat? What do you eat? I even have a lecture called So What Can I Eat? And so as you start going through the holidays, I've got tons of recipes in this book. It's on the website, drjoe.com. We have a PDF. We can send you a hard copy. If you ask nice, John might even make me sign it. So we have answers. I know it's kind of old school looking at a book, but we have answers. I've been working 40 years to answer every question you can possibly have about healthcare and what you can do holistically, naturally, on your own. Sometimes you need to work with the doctor. Sometimes you can do it on your own. So if you want that, everything's on the website, drjoe.com, drjoe.com. All the supplements we talk about, especially with holidays coming up now. I know we're talking about signs and symptoms you shouldn't ignore, but I'm going to go off on a tangent here. I really want you to get Dr. Joe's digestive enzymes. And I want you to take one with every meal. Now, if you're going to eat a big holiday meal, I wish you wouldn't, because you can only eat, your stomach, by the way, is only the size of your fist. How much food are you going to put in your stomach if you're the average American on Thanksgiving? 3-4 times that amount? Your stomach can't handle it. Your stomach's going to stretch. It's going to force food up into the esophagus. You'll have heartburn, acid reflux. You're not going to digest the food properly. It's going to go into the small intestine. Proteins are going to putrefy. Carbohydrates are going to ferment. You're going to get gas and bloating. You're going to feel awful. It's going to weaken your immune system. All because you want to stuff yourself silly. Gluttony. It's one of the big 7, man. It's one of the 7 deadly sins. So don't stuff yourself silly. Eat moderate amounts and take digestive enzymes. I take them every day throughout the year. You should too. If you're over 40 years old, you're even probably over 30, you should probably be taking digestive enzymes. They're really cheap. Carry them in your car with you. Take them every time you eat a meal. Watch what happens in just a couple of days. Phenomenal. Now, if your digestive system is really messed up, you might need to take 2 with every meal. Ooh, big change there. So that's something you should take. Of course, I take Super Greens and Essential Source every day. They have enzymes in them as well. And that's the minimum supplements you should take. A scoop of each every day. Don't miss. Because here's what happens. People come to me, Dr. Joe, I got your Super Greens and Essential Source. I've had it in my cabinet for 2 years now. It's not going to do you any good. That's a 1-month supply. Use them. They're designed to go in your body, not in your cabinet. They work a lot better when they're in your body. So, drjoe.com. Now, I'm not going to get to everything I need to today because I always prepare way more information than I have time for. If you want a copy of today's show notes, I will send it to you absolutely free. It's my gift to you. Send me an email through my website, drjoe.com, and just say warning or warning signs, and I will send you today's notes. And we used the same notes for last week, too. Absolutely free. Why do I do this? It's a lot of work to put together show notes and then email them to everybody who requests. We do that because I really want to get to the cause of your healthcare problems. I really want to be your doctor. So drjoe.com. And all the supplements we talk about, Super Green, Central Source, digestive enzymes, vitamin D3, K2, vitamin B, men's hormone support, omega-3 fatty acids, adrenal support, nitric oxide. Oh my gosh, if you're not taking that, you should. Opens up the blood vessels, lowers your blood pressure, increases circulation to your heart, your lungs, your reproductive organs, your brain. They're all on the website, drjoe.com. Why don't you just order them? Get them. Take them. It's way cheaper than drinking coffee every day. So it's better for you and it's cheaper. I wonder if I should do that or not. Yeah, of course I'm being a wise guy. Yes, you should do them. So minimum Super Green Essential Source, vitamin D, and B complex. That's the minimum, but I add more to it. And the reason is, a patient asked me this the other day. She said, Dr. Joe, I hear you talk about all the time about the nitric oxide and women's hormone support and adrenal support and estrogen regulator, and we have one to clean out the bowels, intestinal formula. And they say, why do you only recommend, when a patient comes in, I usually put them on a 6-supplement protocol. I said, because I've learned over the years that some people get scared. 6 is kind of like the magic number. People are okay with 6 supplements or less. But if I go higher than that, she goes, no, I want whatever you take. And I put together a protocol. She was fine with it. So I don't want to scare you away because this is new. I understand that. But why wouldn't you want to get healthy? Makes no sense to me. So if you have a health issue, neck pain, back pain, shoulder pain, digestive issues, we're talking about bladder issues, brain issues, come see us. Let's see if this is something that falls in our wheelhouse. And if it doesn't, let me refer you out to somebody who I trust that you can go to. So if you have any questions, drjoe.com, drjoe.com. You can book appointments right online. As soon as you open up the homepage, it says book an appointment, ask a question. It's very simple, drjoe.com. Normally the first visit is $940. I've reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Any one of those is going to cost you more than $299. I'm putting it all together because I want to find out if what you have is something I think we can help. And if it is, I'll tell you. If it's not, I'll tell you that too. Stop suffering needlessly. Every day, everywhere I go, 24 hours a day, it seems like, but every time I'm out somewhere, if somebody recognizes me, they have health questions. So why not get to the cause of the problem? drjoe.com. I want to be your doctor. And we accept most insurances. If you're ever in a car accident, if the car is damaged, you're damaged. 100% of the time. I've never seen it any other way. Come see us immediately, even if you caused the accident. I had a patient come in the other day. She caused the accident. She goes, well, I caused the accident, so there's no lawsuit. I said, what about the damages you have? And she kind of looked at me. I said, yeah, just because you caused the accident doesn't mean you weren't hurt. Not only the victims are hurt, you're hurt too. I never thought of it like that before. We looked at her car insurance. She had something called MedPay. So there's lots of ways to get the care you need. drjoe.com. All right. Whew, man, I got so much more to cover. So we're talking today about symptoms you shouldn't ignore. If you have sudden pelvic pain, like a stabbing pain in the pelvis, especially for women, you probably want to get that checked. It could be an ovarian cyst. It could be an ectopic pregnancy. I used to date a girl, and every now and then she'd get this stabbing pain. I remember one time I said, you need to get to an emergency room. She goes, oh, I know what it is. I have ovarian cysts, and when the cyst bursts, this is what it feels like. Oh, okay. She knew what it was at least. But if another issue you don't want to ignore, for gentlemen, if you have ED, problems performing in the romantic department, that could be a very serious warning sign. Of course, you think of it as, oh gosh, I can't perform, and it's emasculating, but it could mean something like heart disease. It could be clogged arteries. It could be a hormone imbalance. It could be pinched nerves in the low back. So if you have ED, gentlemen, you can do several things. One is you can take a little blue pill that you can order online, and it rushes the blood supply there, and it may help. The problem is that it rushes the blood supply to everything almost too much. And I know friends of mine that work in the emergency room, and they say, oh, every couple of days, sometimes every day, more than once a day, men come in, took the little blue pill, And now they have this constant situation. And it's very serious because if you can't stop functioning, trying to keep this clean, you can cut off the blood supply and get something called necrosis. You can cut off the blood supply to your tissue. The tissue can start to die. And again, those treat the symptoms, and I'm not against that if you need to, but there's multiple other things. Gentlemen, we even have an ED quiz on our website. If you go to the website and fill out the ED quiz, I'll send you the protocols based on your quiz answers that I recommend for patients with ED, trying to get to the cause of the problem, looking at it not as a social issue, but as a health issue. Why are things not working properly? Isn't that an interesting question? I've been in practice 40 years. Every day, when patients come in, I'll look at their x-rays. I see arthritis constantly. Oh, my other doctors told me that. I said, did anyone ever tell you why you have arthritis? 100% of the time, I get this deer in the headlights stare. No, nobody's ever told me why I have arthritis. Osteoarthritis is mechanical. Bones are out of alignment, rubbing up against each other. So let's assume you get surgery. Let's assume you get injections. That may help the pain, but it doesn't realign the bones that caused this thing to begin with. The misalignment was the starting point of it all. So let's realign everything, even if you need surgery, even if you've had surgery. Let's try to get to the cause of the problem and not just treat the symptoms. And this is the trend that we're seeing in healthcare. More and more doctors are pulling away from traditional ordinary healthcare, going into what we call functional medicine or things like I do, and they're coming to me every day. And I love when doctors who've been in practice 30, 40 years even say, Doc, can I just follow you around one day? Can I see what you do? Because it's phenomenal. I said, doctors say, patients come to us every day and say, Dr. Joe said, I heard Dr. Joe do this. I heard his podcast. I heard his radio shows. I read his books. I follow him on social media. And they said, so you're the guy that everybody's talking about. I said, yeah, I'm the guy everybody's talking about. Why? Because what we do works. Not all by itself. Sometimes you need help. But come on, let's see you. All right, let's talk about some more things. Symptoms you don't want to ignore. If you have unexplained weight loss, all of a sudden you just start losing weight like crazy, go get checked. Could be cancer. Could be a thyroid issue. It could be diabetes. So if you're not trying to lose weight and suddenly you're losing a ton of weight, I know you're thinking that's not a problem. It could be a warning sign that there's something wrong. If you have night sweats and fever, now women, you could be going through menopause. And as the estrogen levels drop, let me explain to you why you get night sweats, okay, or hot flashes. Estrogen goes into your brain, a part of your brain called the hypothalamus, and that's the thermostat in your brain. And estrogen regulates the thermostat. So as you start going through menopause, your estrogen levels drop. So you don't have anything controlling the thermostat anymore. So what happens is the thermostat goes wacky and you might have these hot flashes. So what can we do about that? We do a test. It's called a Dutch test. It's a urine test. And we can monitor your hormones and find out where the problem is. Not, hey, I'm low in estrogen. Why am I low in estrogen? Am I not producing it? Am I not breaking it down properly? Am I not converting it properly? And then we can try to fix the break in the broken link in the chain. You can do things like phytoestrogens. Phytoestrogens are not estrogen, but they can sometimes help. So, for example, somebody said to me the other day, well, Dr. Joe, I don't eat soybeans because it's high in estrogen. Well, it's high in estrogen that activates the beta receptor sites in your body. The alpha receptor sites are the ones that cause abnormal cell growth and breast cancer and things like that. So just because it has a phyto plant estrogen in it doesn't mean it's going to act like human estrogen or animal estrogen. And in fact, it can actually prevent you from absorbing the bad estrogens. So phytoestrogens are not animal estrogens. They work differently. So sometimes getting somebody on some phytoestrogens, like soy products, organic soy products, it may help regulate those hot flashes. Or we can do things like women's hormone support. It's on the website, drjoe.com, which can help balance out your hormones. Or maybe it's a vitamin D deficiency, because vitamin D is actually a hormone, and that may be an issue. I had a patient the other day. Well, I didn't. Dr. Kat, one of my doctors, did. And she said, young girl, severe depression, had done everything. Nothing was helping. She goes, and Dr. Kat was saying, I was getting scared. I was afraid she might do something radical. She said, I got her on vitamin D. I got her on 10 drops, Dr. Joe's vitamin D3 with K2. She came in a couple of days later. She says, I'm starting to feel better. I'm not as angry. I'm not as, she said, like she's going to hurt herself. And vitamin D is so important even for emotional issues. So I know this sounds a little complicated. There's a lot of moving parts, but the bottom line is get the nervous system working, get the digestive system working, get your diet straightened out. And my team of doctors and I are really good at doing those three things. So if you want to make an appointment, just go to drjoe.com, book your appointment. So we're talking today about warning signs you shouldn't ignore. If you have pain that interferes with your life. Now, we all have pain. I think if I ask anybody right now, think of your body quietly, what hurts? My shoulder, my hip, my knee. I didn't think about it, but I'm having some pain. Pain is okay. Pain is telling you something's wrong. Don't be stupid, is what it boils down to. And don't make it worse. But if you have debilitating pain, where you can't function, fibromyalgia, for example, let's get to the cause of that. We only have so many days in this game we call life, right? Prince called it, right? This game we call life. We only have so many days. Why wouldn't you want to live every one the best you possibly can? And here's the thing about healthcare. It's so much less expensive to be healthy than it is to be sick. I can't afford supplements. I can't afford drugs. I can't afford surgery. I get that. Many times you can't afford not to. Now, I understand there are limitations, of course, but I cut my mouth a couple of years ago. This is way before, many years ago, no, guys, before I was on the radio. And I cut my mouth. I was on a date, and I was making dinner at my house, and I put a big spoon in my mouth, and I sliced the inside of my mouth. And she said, you need to go to the emergency room. And I did. First time I ever went to the emergency room in my life, aside from a broken arm in high school. And I sat there for, unreasonable amount of time. Doctor comes in. He goes, stop bleeding. I said, yeah. He goes, you want a tetanus shot? I said, no. He says, okay, if it starts bleeding again or gets infected, come back in. That was it. That visit, a couple of hours, and the doctor was only with me. I mean, literally, that was the whole consultation. Cost more than a whole year's worth of treatment at my office. Wow. I'm in the wrong business, man. I should have started a hospital. So make it a priority if that's your goal. And if not, that's okay too. If you don't want to make your health a priority, that's fine, but that's why I do these shows. That's why I do these podcasts. So drjoe.com. Send me your questions. Follow me on social media, Facebook, Instagram, YouTube, TikTok. We post twice a day. Podcast, Dr. Joe, for the health of it. Please subscribe to that. Subscribe to my YouTube channel as well. By the way, it costs you nothing to follow me on social media, subscribe to my YouTube channel, and subscribe to the podcast. Absolutely free. I would appreciate it as a gift. I give you all this information. Give me a gift back. And I'm not asking for any monetary gift. I just want you to follow me. Because the more followers we have, the more our message gets out there. And the more people can get to the cause of their healthcare problems. So drjoe.com. And send me your questions through the website too, drjoe.com. Happy to help you with that. So other issues that you don't want to ignore. If you bruise easily, and this happens a lot, especially with seniors, your blood vessels may be weak. Now, it could be that you have other serious issues, but sometimes it's as simple as making the blood vessels stronger, and you can use something called bioflavonoids to build up your blood vessels. Bioflavonoids are found in things like fruit, citrus, for example. Dr. Joe's Essential Source, loaded with bioflavonoids. Had a lot of people. A patient came to me a couple of years ago, and I still remember the story. I've told it before on the air. She said, Dr. Joe, I have to tell you something. I said, what's that? She goes, I can't afford not to take your supplements. And I heard you can't afford to take my supplements. And I said, say it again? She goes, I can't afford not to take your supplements. I said, I don't understand what you're saying. She said, before I started taking your supplements, I was tired. I didn't want to work overtime. I wanted to leave early. My home life was affecting. My romantic life was affected. She goes, since I've been taking your supplements, I feel so good that I'm able to work longer. I'm able to spend more time with my boyfriend. I'm able to spend more time with the church. She said, so I can't afford not to get well. She goes, so thank you for doing that. And thanks for pushing me, because she was like, oh, I don't know if I want to take them. So she said, I thank you for pushing me. It was great. All right. If you ever have a sudden loss of hearing, that can be urgent, or sudden loss of vision. Don't wait. I had my eye, I remember getting flashes in my eye a couple of years ago when it was on a Sunday. I called my eye doctor. I went to go see her. She goes, no, it's okay. You're fine. But I'm glad you came in because it could have been a stroke. So anyway, I'm not able to finish everything I need to today. If you have any questions, send them to me through my website, drjoe.com. If you want a copy of today's show notes, I'm gladly send them to you absolutely free. Just some stuff I didn't cover. Just send me an email through the website, drjoe.com, and just put warning signs or warning in the email. I'll send it to you. My gift to you. No problem at all. If you want to make an appointment, drjoe.com. Social media, we post twice a day. Facebook, Instagram, YouTube, TikTok, podcast, YouTube channel. And all my supplements are on the website in the store section, drjoe.com. Folks, thanks for tuning in. I'm Dr. Joe Esposito. Talk to you next time. Bam. All right. You have any questions? Usually do.
Should I incorporate a daily skincare routine?
Absolutely. Why wouldn't you? A couple of things you can do. Get yourself a loofah or a good sponge and scrub your skin down every day. I remember years ago, there's a cool place in Atlanta. It's called Jeju Spa. And you go there for a whole 24 hours. You pay for 24 hours. And it's a Korean-run spa. And many of the locals there will actually scrub themselves. There's a men's area and a women's area, and then you go into these saunas and stuff as you dress in basically scrubs. And you can join, male or female, but then there are separate locker rooms. And they were like scrubbing their skin. And I thought, oh my gosh. And I said, no, it exfoliates the skin and gets you healthy. You should only use a soap that you can eat. What a strange statement. I use Castile soap, Dr. Bronner's. There's other brands, Castile soap, because whatever you put on your skin can be absorbed directly into your skin. So if I'm putting a toxic chemical on my skin, it can be absorbed into my skin. Sunscreen, for example. Zinc oxide should be the only sunscreen you use. If you have to, you can use titanium dioxide. That's it. Those are the only two. Those sunscreens, the main ingredient should be zinc oxide or titanium dioxide. Because I've been preaching about this for decades. And last summer, there was a report that came out that said sunscreen may be more dangerous than helpful. And I won't give you a whole lecture on sunscreen. But natural soaps, natural deodorants, scrub your skin every day. I do it. You should too. Men have a benefit because we shave. So we shave off dead skin. Women don't. So exfoliation is important, but make sure you're using natural products that don't have any toxic chemicals. But the key really is going to be the soap. Use a Castile soap. You'll be very happy. Thank me for it. What else?
Is creamed corn okay?
Depends what you cream it with. Now, if you're going to use cornstarch, many times it's from genetically modified corn. I don't know if they have organic cornstarch. It must exist out there. But if you're going to use a thickening agent, you can use an organic flour. And gluten is the thing that makes it stick together, unfortunately. So if you're going to use a thickening agent, organic wheat flour, I wish you wouldn't, but if you do, that would be a better choice. Unless there's an organic cornstarch I don't know about, but I've never looked either. So I do like cream corn. Make sure the corn's organic, because if it's not organic, chances are it's genetically modified. That's not good either. So there's some things you can do to make it better. What else?
What canned fruits and vegetables do you trust?
Canned. I'm not a big fan of canned. If you have to do canned, at least do organic, because most cans are lined with something called bisphenol A, sometimes bisphenol S. And it lines the can so that the food slides out easily, but those are endocrine-disrupting chemicals. So if you're going to do a can, I would recommend organic only if you're going to do anything canned. So that would be probably my general statement on that one. What else?
Why is shingles so painful?
Because it's a virus that gets into the nerve, and it causes the nerve to become massively inflamed. Now, many times shingles you'll find follows a nerve path. It comes out of the spine and travels along a nerve. So oftentimes chiropractic care, by adjusting the root of that nerve, opens up the nerve and blood supply and helps, doesn't cure, but helps reduce the pain. Now, you want to stay away from peanuts if you have shingles or herpes, because shingles is a herpes virus. Almost everyone, I can't say everyone because I haven't tested everyone, has some type of herpes virus in their body. Not necessarily genital herpes, but shingles is a herpes virus. There's other types of herpes viruses. And peanuts are high in arginine, and arginine can actually stimulate herpes virus to become active. So stay away from any food that's going to be high in arginine, specifically peanuts. It can make it worse. Now, chiropractic care, anti-inflammatory diet, turmeric, nitric oxide support, B-complex. These are things you can do naturally. Super Green, Essential Source, to help bring down the inflammation. But it hurts because the virus is in the nerve. That's why. So, what else?
Is eating cherries every day okay?
Yes, absolutely. Try to do organic if you can, but cherries are great, yeah. What else?
That is all.
Thanks, guys. I appreciate you very much. Please follow me on all social media platforms. I would appreciate that. And any questions, drjoe.com. Best thing to do is what? Make an appointment to come see us. I hope to see you